Hi, guys. I'm Kenya Brown, and welcome to Black Health 365. And we know it's time for back to school. And as families gear up for the new school year, we're focusing on two key parts of children's health: the importance of annual well child checkups and protecting kids from flu season. Joining us today is Dr. Natalie Woods, pediatrician at University Hospitals, who will share why these visits matter, what families can expect during back to school checkups, and how flu vaccines help protect not just children, but entire families and communities. Now, let's dive into how these steps can make a meaningful difference in keeping kids healthy, learning, and thriving this school year. Hi, Dr. Woods.
Hello, how are you?
I'm doing all right. I'm dealing with flu season from my third grader and my sixth grader. So, every year it's something.
It sure is.
Absolutely. So tell us, why are well child visits especially important before
Mhm.
children return to school, and how can they help meet unique health needs?
I'm sorry it froze, so I missed part of your question, Kenya.
Uh-oh. Okay. Now, why are child visits especially important before children return to school, and how can they help meet unique health needs?
Well, well child visits are particularly important because they offer an opportunity for preventive care. Children can get physical examinations, they can get caught up on immunizations, whether that be booster shots or flu shots. We can do routine screenings for hearing, vision, or mental health. In the African American community, it also reinforces trust through continuity of care. When you see the same provider year after year, you build a relationship, and that results in better health outcomes.
Absolutely, because you can tell where their baseline was, where they are, if there are changes, any of those things, and those definitely help when they're in the classroom and trying to focus. You don't want all those sick days and all of that. Now, how should parents prepare for well child visits?
Parents should prepare by writing down your concerns prior to the visit, whether that be developmental concerns, behavior concerns, school concerns. It's a good idea to have those written down because in the moment, sometimes we forget. It's also important to update your provider if there are any changes in your medical health record. This may include any changes in family history, new allergies, any new medications that the child is taking, or if there are any changes in any chronic medical conditions.
Absolutely, yes, those are all very important. Now, what are highlights parents should watch for during these visits for school age children?
During our school age visits, all visits, we assess growth and review that with the family. We also address nutrition, physical activity, sleep, behavior, school performance. Starting at age children as well as blood pressure screenings. We also do developmental check-ins at this younger age from like 3 to 6. At 4 years old, we start to update school entry immunizations and we also start hearing screens. Between 9 and 11, we generally start cholesterol screenings. As kids get older school age children, we cover different issues. We might start to talk about puberty, safety. We also update adolescent vaccines for our adolescents, and that includes our tetanus booster shot, the meningococcal vaccine, and the human papillomavirus vaccine.
I wasn't aware that they checked for your blood pressure and cholesterol, things like that for even the little ones, huh?
Yes, yes, starting at 9 for cholesterol, and for our little ones, every year from 3 up, you should have your blood. They should have their blood pressure checked.
Wow, okay. Now, why is the flu vaccine particularly critical for children as they head back to school?
The flu vaccine is critical because fall is the season that the flu spreads very rapidly among school age children. When children are vaccinated against the flu with the flu shot, it helps protect them from getting the flu as well as family members, close contacts in the home. We know that the flu can be more severe in children with certain chronic medical conditions like asthma and diabetes that are prevalent in the African American communities.
Absolutely. And, kids, they're more apt to touch everything. I know my kids like to hug everybody, and it's like this whole communal thing. So yes, you want to get them protected. Now, what healthy habits and routines should families establish for back to school and flu season readiness?
It's important, very important, to establish a consistent sleep routine as you prepare to go back to school, to have balanced nutrition, to have daily physical activity as well. All of these support healthy immune habits. We should educate our children about hygiene, frequent hand washing, not sharing those personal items in school, and also having a sick day plan, knowing when not to send your child to school if they're sick, knowing what support you might need at home if they're sick, and knowing how not to spread those illnesses between family members in the home.
Absolutely, for sure. And I can't emphasize enough, like what you just said, the healthy habits. Some people overlook, they're looking for the big fix somewhere off in the sky. But if you keep those healthy habits, they can help you tremendously. The eating well, the sleeping well. Do not discount how important those things are for you and your children. And I want to thank you for joining us today and sharing such important information about preventive care. As we finish, I want to remind everyone to prioritize your health by finding a doctor that you can trust. Call 216-223-9959 to schedule an appointment today. To learn more about our Black Health 365 program, visit wzakcleveland.com/BH365. Thank you so much, Dr. Wood.
Thank you for having me.
Absolutely. And make sure you share this video. Until next time, with more Black Health 365.